A very good morning and a warm welcome to everybody for joining today's webinar, which gains significance on the eve of International Women's Day, when we have chosen to discuss the importance of good health care that supports women physically, emotionally, and mentally. Puberty to menopause is the topic of the webinar presented by Kauvery Hospital in collaboration with the Hindu. And we have a nice panel of women doctors, as you can see on your screens, who will take us through this session. The theme of this year's International Women's Day is Accelerate Action. And the objectives of World Health Day this year is to improve the health and survival of mothers and babies, also to advocate for universal health coverage, to promote health equity, to encourage healthy behaviors, and strengthen our health systems. A combination of both the day's themes calls for speeding up our actions and taking decisive measures to address issues that affect women in every sphere of life. And as all we would agree, that health gains priority over everything else. So over the next half an hour or so, we will hear from our three obstetricians and gynecologists who will take us through the stages of puberty, fertility, and menopause. And after the panelists finish their presentations, we would be happy to take questions from the audience. So over to the introductions now. Our first speaker is Dr. Satya Sudhakar, consultant from Ma Kauvery Hospital in Salem. Dr. Satya, after completing her MBBS and DGO from Sri Ramachandra University in Chennai, did a super specialization course in reproductive medicine from International School of Kiel in Germany. A first rank holder in PG, her areas of interest include infertility and IVF counseling, adolescent care, high risk obstetrics, postmenopausal and geriatric women health care, gynecology, and palliative care. Dr. Satya's strengths are treating gynae endoscopies and infertility, patient-centered counseling, and special discipline care. She will speak on how to accelerate women's health across all age groups. Welcome, Dr. Satya, and we would like to hear your talk.
Good morning to all the gorgeous women here. Wishing all a happy International Women's Day. And can I start, ma'am?
Yes.
Is it visible, ma'am?
Yes, ma'am.
Yeah. Today my topic is accelerating women's health. So women's health is the accelerating women's health is a theme for this year's Women's Day. So this is the part of health is being missed by all women. Why do they miss taking care of their health? What are the challenges faced by women in their general health practices? They have limited access to healthcare in rural areas, so they forget to take care of their health. And women prioritizing their family over their own health. And there are some social stigmas and taboo due to lack of health education in the rural areas. But these are better now in the current generation. And what are the progress in the current generation women health? Advancements in screening tests which are available, and increased health education in developed areas, better access to technology. So major health issues faced by women in their lifetime, they can be classified into so many types: obesity, hypertension, reproductive health issues, several cancers like breast cancer, cervical cancer, endometrial and ovarian cancer, PCOS, and menstrual problems. So there are varied number of symptoms for each and every disease. And PCOS is a very common issue among adolescent girls and reproductive age group. So it starts from like childhood and adolescent obesity, which forms childhood and adolescent obesity is one of the problems faced, and they have all these irregular cycles and all. So why do they have obesity? That's because of sedentary lifestyle, their preference for junk food. They have several stress and mental health issues and sleep disturbances at a very young age. So we have to understand them every, I mean, we have to understand every individual separately. So each individual, we should advise them about their normal BMI. We should explain to them what is their body mass index. So body mass index should be within the normal range from 18 to 25. So we should advise them on regular exercise, at least 45 minutes to 1 hour per day, or weekly around 60 to 115 minutes per week. So they should have a good sleep hygiene. They should follow a balanced diet and stress management. If they cannot manage, we can counsel them on stress management. So, what are the essential basic health practices for women? So, they should follow a balanced diet and hydration, which forms an important part of their diet because it can lead to dehydration, can lead to urinary tract infections for women. Then, as I told you already, they should have a workout schedule every day, and sleep hygiene is at least minimum of 6 to 8 hours. And reproductive hygiene should be maintained. They should attend all these health screenings and checkups with a gynecologist or a family physician. Advancements in pregnancy care nowadays, what do? We have close monitoring of high risk pregnancies, and we do a genetic screening for all abnormalities in the early pregnancies itself. And we are able to screen all genetic disorders in early pregnancies. Multidisciplinary approach, that is, we have cross referrals with other cardiologists, nephrologists. So we do a group approach to treat a person with high risk for high risk mothers to reduce the maternal mortality and advancements in fetal medicines. We are really thankful for all that to find out all the abnormalities and how to treat them in the early stages. So, health tips for working women. I think most of us will be working, and for them, they should prioritize self care. That should be the number one priority for them. And time management. I know it's very difficult to manage time, work, diet, children, husband, anybody, but time management is very important. It's very difficult in initial stages. When you start practicing time management, I think it's very easy. So you must follow a healthy diet, good sleep, and exercise. Building a strong workplace team. So instead of having all workplace enmities and all, we can have a strong workplace bonding to have a healthy workplace team. And regular health checkups and seeking workplace counseling support. I think all of us are supported with the workplace counselors and all. So, what are the crucial aspects before and after childbirth? So, our hormones play an important role during childbirth, before childbirth, and after childbirth. So, we should have healthy pregnancy goals. Go for regular scheduled medical checkups. Trust your doctor and follow only a doctor's advice. Don't go and Google and go for YouTube advices by any other non medical people. Stay physically active during pregnancy, and you must have a good postpartum care. And for this, an entire family should support you, and we should give them importance of breastfeeding for every individual. So, mental health is often ignored for every woman, I would say, from children to menopause. So, that is the base of a good physical health. Importance of emotional well-being is very, very important for a good, healthy relationship with every other person in our family. So, there are so many strategies to maintain, I mean, to manage premenstrual stress and anxiety. So, as I told you, hydration, diet, exercise is the core of this PowerPoint. And you must engage in some hobbies like drawing, painting, stitching, tailoring, whatever you can, and seeking healthcare support as early as possible. Important screenings, what we do in our hospital for women from reproductive age group are like we generally ask our women to come for pap smear screening from the age of 24 to 65 years because this is the only screening test you can during the screening itself you can find out whether they are at risk for a cervical malignancy or not. And for mammogram for people above 40 years plus, if they have a family history or they have any other symptoms regarding their previous histories of breast pain, breast enlargement, lump in the breast, all that, etc., they can come for a mammogram checkup. Routine ultrasound, which is included in all our master health checkups, and weight monitoring, which is very important because obesity leads to a lot of cancers also. So cervical cancer prevention is it is the only cancer which can be prevented by a vaccine. So I think everyone is talking about HPV vaccination. I don't know how many of us are aware about it. So my short gist on HPV vaccination. So we are advising adolescent children for around 9 to 14 years, 2 doses of HPV vaccination, and 15 years and above, 3 doses of HPV vaccination. So HPV is the virus which causes cervical cancer. It not only causes cervical cancer, but it can cause even benign conditions like warts in the private parts, cervical erosion, cervicitis, all that. So for them to prevent cancer, you have to prevent the causative agents. So cervical cancer is seen among the people who have a poor sexual hygiene and multiple sexual partners, teenage marriages and all. So for them, we should advise safe sexual practices. Sex education is a must in all schools and colleges. Avoiding multiple partners and universal screening tools should be used. So our latest advances in obstetrics and gynecology, now we have 3D, 4D images where you can see the baby's face, you can hear the heartbeat along with the baby's movements and all can be seen live. So that is a really an advancement, and the anomalies can be easily screened. And surgical wise, now we have robotic assisted laparoscopic hysterectomies and all, hysteroscopic procedures and all. And fetal interventions also can be done. There are genetic advancements which can be done intrapartum, and telemedicine counseling also is available from here to abroad. You can get even opinions from other countries. So, advice for young female healthcare professionals is to not only healthcare professionals, whoever is working. So, build a strong mental and physical health. Let the goal be you. So, trust in yourself first, trust in your body, multidisciplinary approach in complex cases, stay updated with the medical advancements, and always be in touch with continuous learning and research. So we have done several outreach programs out here, like routine cancer screenings we do every day, cancer awareness programs for our staffs in schools and colleges. We do menstrual hygiene awareness programs, and we give psychological health programs for our hospital staff. And we conduct a marathon, walkathon for public health awareness, and we conduct self-help group programs for physical and mental health for other women. So the role of family and society in women's health is rule number one is prioritizing your health, then others. Family support for physical and mental well-being. So it's always a hand in hand with your family. Changing societal views on women's health issues. So happy Women's Day. Turn promises into progress. Thank you, ma'am. Thank you for giving me this opportunity. Thanks a lot.
Thank you, Dr. Satya, and for the detailed presentation and taking us through the various stages in a woman's life. And I mean, we do realize that a lot of things are better. I mean, they are easier than done, easier said than done. But we have to keep talking about them. Next, we will hear Dr. Divya from the Trichy branch of Ma Kauvery Hospital. Dr. Divya did her undergraduation and post-graduation from PSG Institute of Medical Sciences. Trained in laparoscopy, hysteroscopy, and obstetric ultrasound, Dr. Divya has a master's degree in clinical embryology from Australia. She will offer insights into fertility awareness in reproductive age group. Welcome, Dr. Divya, and over to you.
Thank you, ma'am, for the kind introduction. Share. Share option. Okay. இது எப்படி இருக்கா? Share ஆயிடுச்சு actually. இது minimize பண்ணலாம் side. Can you see my screen, ma'am?
Yes. Yes, we can.
Okay. So far, we have heard about the generalized women's health. Now I'll be focusing more about fertility awareness in reproductive age group. So when you should start think about your reproductive health? Can anybody give answer?
Ma'am, you can continue with the presentation, please.
Okay. So the reproductive health starts from the fetal stage itself. If a mother is abnormally having any diet, diabetes, maternal obesity, all these things can affect the fetus epigenetics and cause fertility issues right from the mother's womb. So these things can causes even uterine anomalies even from the childhood itself. So if you see, there is a drug which is called as diethylstilbestrone. If it is taken by our great grandmothers, it can pass on through our generations and causes uterine anomalies, which can lead to fertility issues in the future. So we all know that we start our menstrual cycle around 12 to 14 years of age. So we start ovulating, and then during mid of your cycle, you ovulate, and then you get your menstrual cycle. This is a continuous process starting from the age of 12 to 45 years. So if a patient is having periods, the secondary sexual characters without menses, then it is called as primary amenorrhea. Or if she is having secondary sexual characters without menses up to the age of 16 years old, or if the patient is as menstruated, but after some time, if they start menstruating, it is called as secondary amenorrhea. So you can categorize amenorrhea as primary and secondary based upon at what age they're going to menstruate. So after the period of puberty and menstruation, once the girl gets married, then the next question is when they should plan their pregnancy. So age is a very important factor to plan your pregnancy. As the girl advances in age, starting from birth, if you see the number of follicles in during birth is around 7 millions, then it slowly drops down to 1,000. So the girl reaches her peak fertility age around 20 to 25 years. If they cross 30 years, then the fertility starts declining slowly above 30. So if you're working, then it's very important that you have to balance both your work and your family life. So work related stress causes major issues in the family and leads to infertility issues also. So being overworked is the most commonest cause for work related stress that can affect around 63% of the couple or the female, that can lead to work stress and infertility. So there is a strong relationship between stress and infertility. If you see, work stress can cause up to 25 to 60% of the individual to undergo any psychiatric symptoms like anxiety and depression, which is significantly higher. So this stress, what it causes environmental stress, and all the emotional and physical stress can affect their hypothalamo pituitary axis, which causes hormonal imbalance like lower FSH, LH, oocyte reduction, altered follicular fluid composition, and all those things can lead to infertility. So main commonest cause for infertility issue is ovulatory disturbance or fallopian tube factor, followed by unexplained infertility. That is, we don't identify any cause or the reason for infertility. Then the next is the uterine factor. Out of this ovulatory dysfunction, the most commonest problem faced by all the female is polycystic ovarian syndrome, which contributes up to 85%. So in ovulatory dysfunction, the females can have polycystic ovaries or any hypothalamic dysfunction or premature ovarian failure. That is, if the lady is having accelerated follicular depletion. If you see, this is a normal healthy ovary, but even at the early 20s or late 20s itself, some people will have diminished ovarian reserve that can cause premature ovarian failure, and some can have thyroid or prolactin dysfunction. So fallopian tube is something which acts as a bridge for the egg to enter into the tube, get fertilized, and enter the uterine cavity. If there is, because of any infection or any previous surgeries, if there is a block, then the patient can have fallopian tube related causes leading to infertility. So we do a simple test which is called as HSG. We can assess the tubes whether it is functioning properly or not. In this picture, you can see a free peritoneal spill of the dye, which indicates that the tube is functioning normally. But if you see in these pictures, there is block in the tube, and here you can see one side block, and there is some uterine anomaly. So by doing this simple test, which is not expensive, we can identify the tubal function. So when we are in a doubt in this HSG test, we advise the patient to go for laparoscopy, where we can 100% be sure that the tube is functioning properly. So the next is most commonest thing is ectopic pregnancy. If the patient is having any tubal dysfunction, so any pregnancy, if they get fertilized in the tube, and after 5 days it comes to the uterine cavity. But in case of any tubal dysfunction or disease, the egg or the embryo, they get stagnant in the tube, and once the tube is a very soft structure, it cannot expand like the uterus. The musculature is very thin here, so it will rupture. So that is a emergency. So ectopic pregnancy has to be ruled out in case of any emergency abdominal pain if the patient is having pregnancy positive test. The other thing is uterine diseases like fibroids, adenomyosis. So the main thing is if the fibroid is in the uterine cavity, that is inside the endometrial cavity, it can affect and cause fertility issues. If it is protruding or indenting into the cavity, the fibroids which is away from the cavity may not affect fertility. So simple endometrial polyps can be made out in ultrasound. So if we remove the polyp, the patient might get pregnant spontaneously. So this is a polyp. This is a 3D ultrasound which shows a polyp image. This is a hysteroscopy where we put in a scopy inside the uterine cavity and visualize and remove it. So these are the simple procedures where we can go for directly simple treatment which will minimize the fertility issue. The other thing is endocrine disrupting chemicals. These chemicals can cause dysfunction in the endocrine system and leads to infertility. That is, you would have heard about phthalate, bisphenol A, polychlorinated bromides and all. These things are present in plastics, paints, cosmetics, and the insecticides or pesticides which we consume in our day-to-day life. So this can lead to male infertility and female infertility. So these EDCs are present even in the toys or makeup products. So it is very important for us to avoid these EDCs. How we can prevent the exposure to these EDCs which causes fertility is we should switch on to organic food, avoid canned food. You should avoid using thermal recipes and use a phthalate-free products and replace old furnitures. Avoid using non-stick pans. All these are simple lifestyle changes in your day-to-day life which can prevent you from these harmful endocrine disrupting chemicals causing fertility issues. So how do you approach a fertility specialist is always it is better to go as a couple. Mostly these fertility issues are focused mostly on the females, but equally males are also affected. So always go as a couple. If you have any issues, you have to consult a doctor. You should not become hesitant to discuss any psychiatry issues like anxiety or depression to a psychiatrist. You can always ask for help. So you start your fertility workup. If you're pregnant and trying for pregnancy for more than 1 year, you should definitely reach out to a doctor. And if you're more than 36 years, or if you have done a late marriage or more than 40 years, you should start your fertility workup early and don't hesitate to reach a doctor early. So what we call infertility as a definition is when you fail to conceive even after trying for 1 year with unprotected sexual intercourse, then we call the patient as infertility. So even after trying actively, if you're not becoming pregnant, then you have to go and meet your doctor. And if you're already having any sexual dysfunction, or if you're diagnosed with PCOS or endometriosis or some disease of the uterus, or the male partner is also having any issues, you have to meet your doctor immediately. So you have to start your evaluation, which is the more key to the infertility treatment. Always you should go as a couple. The first line investigation for a male is a semen analysis, and for a female is hormone analysis along with ultrasound pelvis. So if you all do all these lifestyle changes, you can it's key for you to get a positive pregnancy result soon. So some of the treatments I'll be just briefing so that you'll be familiar with the terminologies what we see in these patients. If they are facing fertility issues, we after doing evaluation, we directly go for ovulation induction with a normal intercourse, which is a simple treatment we start on with. Or you can try intrauterine insemination, where we prepare the sperm and just put it into the mother's womb. It is also a cheaper procedure and OPD procedure. It's not expensive. And if it all fails, then only we suggest the patient to go for IVF, that is in vitro fertilization, where we do fertilization outside the body. So that is called IVF. So oocyte retrieval is we stimulate the patient where you see in a normal pregnancy you get only one oocyte, but in this we stimulate the ovaries, and by putting it a needle we retrieve all the oocytes for IVF, and we grow it in a petri dish and fertilize them with the sperm. So like this is how it grows inside the incubator. It has various stages, like stage 1, stage 2 cell. This 2 cells becomes 4 cell, 4 cell becomes 8 cell, then a morula stage, it gets compacted, and finally is the blastocyst, it is the day 5 stage of the embryo culture. So once we culture, we put the embryos inside the womb of the mother. This is a process of IVF where we do only for patients who have failed all the simple treatments. So here is she is Louise Brown. She is the world's first IVF baby. She was born in 1978. She's hale and healthy. So many patients, they worry that this is an artificial technique, and they don't come up for the procedure. They think the baby might be abnormal. So she is a living example that fertility is a simple treatment. Only it looks complicated, but you can definitely opt for it. You need not get scared of IVF treatment. So to conclude, know your body, you be aware of your fertile period. Any doubts with your fertility treatments, you can consult your doctor. Always you have to go as a couple. If you're upset or facing any depression or anxiety, please consult a psychiatrist. Each patient is different and there are many treatment options available. So don't be hesitant to make use of the available treatment. Thank you so much for your patient listening.
Thank you, Dr. Divya, for that very interesting presentation. And before we move on to our final speaker, I would request our audience to start posting their questions in the Q&A box, which is open for you. Our next speaker is Dr. Shruti Sridhar from Kauvery Hospital, Chennai. With an MS degree in obstetrics and gynecology, membership of the Royal College of Obstetricians and Gynecologists, and a fellowship in minimal access surgery, Dr. Shruti has extensive expertise in both basic and advanced laparoscopic procedures. She is known for providing minimally invasive surgical solutions for various gynecological conditions and is also proficient in operative hysteroscopy, allowing for effective diagnosis and treatment of intrauterine pathologies. Dr. Shruti's expertise also includes cancer screening and preventive care, ensuring early detection and management of gynecological cancers. She is experienced in infertility management, offering a range of diagnostic and therapeutic options to help couples achieve successful pregnancies. She has earned a reputation for skillfully managing both normal and high risk pregnancies and providing personalized care to ensure the safety and well being of both the mother and the baby. So, over to you, Dr. Shruti, for some tips for women going through menopause.
Thank you for your kind introduction. So today my talk would be on tips for menopausal care, and I will just start it shortly. One second. Okay, so we all know that menopause is a very natural process, and what is menopause? First of all, it is when you stop having a period, and the average age of menopause is about 45 years to 55 years. And it's only when when a woman gets, when she attains menopause before 40 years of age, we call it as premature menopause. And in that case, a woman needs to be evaluated. So why am I talking about menopause, and why am I talking about menopause today, and what is the whole fuss about? Okay, so when a patient walks into the OPD, the most commonly addressed questions, or the most commonly discussed topics are: my periods have become irregular. Is it normal? I'm feeling hot. I'm sweating a lot. I'm feeling low. I'm having body aches, which I never had before. My vagina has become very dry, and I'm having burning sensation down there. I'm gaining weight. What do I do? And do I need hormonal treatment for all these conditions? So, some of the most common symptoms. See, when we say menopause, usually all roads that lead to menopause might not be tough. But having said that, there are some women who have mild symptoms and they get away. They cruise through the menopause quite simply and easily. Whereas some women do have severe to moderate to severe symptoms, and it definitely affects their daily life, and it also plays a role in their workplace, and also in the personal life. Can you come here, please? Why is that doing presentation? Okay. Some of the most common symptoms that we see in menopause are hot flushes, night sweats, vaginal dryness, low mood, muscle pain, and joint pain. So first, let's start with the hot flushes. Now, what are hot flushes? You know that women. Women who usually have menopause, the most common symptom that they complain is, I start sweating suddenly and I feel hot all the time, and it can happen any time of the day and irrespective of where you are and what you're doing. And now coming to night sweats, whether you have hot flushes or not, most of the women have difficulties in sleeping in the night because of the night sweats. And also, and also sometimes even the sleep early in the night, they might not be able to sleep properly because of this symptom. Next, vaginal dryness, because estrogen, we all know that estrogen is an important hormone, and because there is a decrease in estrogen levels in menopause, a lot of women have these symptoms. And one of the most common symptoms that they have is vaginal dryness and burning sensation, because as much as the estrogen reduces in the body, there's also decrease in estrogen in the vaginal tissue, like how it happens in the skin also. And because of that, there's thinning in the vaginal skin, and following which they have dryness, burning sensation, etc. Now, coming to low mood, we all know and we have noticed that quite a few women in the midlife and in the menopausal age, they have uh, different kind of mood swings. Start from, they might have low mood, sometimes they might feel very anxious, they might be depressed, or sometimes you might find that they are not very happy as a person itself, which would not have been their personality before. Now come and then finally the muscle pain and joint pain. All these aches and pains usually starts in this menopausal age, and we will discuss as to why all these happens. Okay. With menopausal age, obviously, when there are hormonal fluctuations and when there's a drop in estrogen levels in the body, these symptoms are tend to happen for most women. And when we say hot flushes, it usually starts immediately during the menopausal time for few women, and it does not mean that these symptoms will last forever. For most of them, it might last for about 2 years, or for sometimes it might also go on for 7 years. Whereas symptoms like vaginal dryness, etc., it might not occur immediately as soon as they attain menopause, but as years go by, that is, as years pass by into menopause, they might find that the symptoms of vaginal dryness and muscle ache and joint pain might increase. So it is, as I already mentioned, some women are they're quite happy and they don't have they only have mild symptoms, whereas some women have some severe symptoms, and it's not fair. And it's very easy to say that yes, it's a natural process and you need to deal with it, but having said that, not all the time it's a very easy thing, especially when it affects their daily life. It might not be very easy for them to handle these symptoms. So, what are the minor changes in their lifestyle that they can do when they attain menopause? When a woman is having hot flushes, that is sudden sweating or a sudden feeling of heat, they can probably switch over to wearing a very loose cotton clothing, and you can always keep your room cold and try to take sips of probably cold water or what, and or try to avoid taking drinking hot drinks, or especially during summers. And a regular exercise will definitely help a person with hot flushes. And I would like to brief a little more about this exercise. So when I say exercise, it's not only for hot flushes. We all should know that when a woman attains menopause, that is when they reach their age of 45 to 50 years old, there are so many factors that come into place. That is, your body's metabolism changes. There are hormonal fluctuations in your body, and the way your glucose levels or the way your insulin works before is not the way it works right now. And also, we should note that there's an increased risk of BP and other heart problems as we age also. So, a regular exercise, especially women in midlife, because we always see that as they age, they become more sedentary, which it should be the other way around. As you age, you should become more active to avoid all these complications. And exercises in the form of strength training, because a lot of women in midlife especially are very scared to do strength training. There's absolutely no reason for you to fear, and strength training, especially for your bone strength, is very, very important. And yoga, it definitely plays a very important role in both your flexibility, and it is also very good for your mental health. And swimming, or your, even if you don't want to do strength training, you can also do simple exercise like jogging and probably zumba, all this, but regularly, at least 4 to 5 times a week, will definitely make a difference in managing your symptoms. And make sure that you have a control over your weight, because as we already discussed, as you reach menopause or even after menopause, your metabolism changes, and even if you are eating less and if you're not exercising, you will still, there's a chance that you might still put on weight. And usually, if you notice, the weight is usually around the tummy, around the belly. That is where all women in this age group usually tend to put on weight. So you definitely need to have a control over weight, because weight increase in weight and obesity will again increase your other symptoms like hot flushes, and it is not good for your diabetes. It's not good for your BP, and also it might increase the risk of cancers. And it is being when your weight is on the higher side, it is not good for your bones. And avoiding spicy food will definitely reduce your symptoms in terms of night sweats and hot flushes. And caffeine, if you are a coffee lover, you definitely need to reduce the amount of caffeine, because when you take too much of caffeine, and if you have symptoms such hot flushes and night sweats, it will definitely impact the quality of sleep, uh, and you might not be able to have a soundful sleep in the night. And it's always better to avoid smoking and avoid alcohol in this age group. So basic diet and menopause. So this is something that we tend to eat, and we are supposed to eat at every and given any point of time in our life. But especially for a menopausal women, you make sure that your food has high fiber, balanced diet, and it should be a very calcium-rich diet. And few vegetables that would help is carrots, tomatoes, cucumber, pumpkin, brinjal, peas, green leafy vegetables, yam, sweet potatoes, some fruits such as apples, papaya, muskmelon, pomegranate, and your dry nuts like walnuts, almonds are very good, and they have very good antioxidants, and especially the flax seeds and sesame seeds. And you definitely need some amount of antioxidants in your diet in this age group. And even garlic and fenugreek, they're supposed to have a very good anti-inflammatory effects. So when you consume that, it is really helpful and has various health benefits. And try to avoid too much of calorie intake, and switch over to healthy options like your whole grains, ragi, sprouts. Take more of dal, and your food should also have a lot of protein in their diet. And as we already mentioned, you need to strengthen your bones, because as you grow older and once you reach your menopause, your bone strength might not, there might be a decrease in your bone strength. So you should take a lot of a low fat milk, curd, paneer, and tofu. That will help with your calcium in your diet. Now, how is menopause related to your heart health? So, estrogen is a hormone, as we all know, because the estrogen is the estrogen does not function like it's supposed to, and that is what leads to menopause. And the work of estrogen is not only for producing eggs for your for pregnancy every month, but it also has various benefits, like it is very protective for your heart, it is very protective for the blood vessels, the vessels where the blood flows. So now, because the estrogen levels in the body has come down, it does not have the protection that it used to provide, as it was in your earlier years. So and so this is the phase where you need to be a little more careful, and you need to focus more on healthy eating. You need to focus on having a regular exercise, and you need to keep your diabetes, your hypertension, and your obesity under check. And if you notice, women tend to have more, there's a increased risk for heart attack for women when you compare to men in this age group, and it's only because of these hormonal changes and the metabolic changes that happens for a women in this age group. Now, coming to menopause and bone density. So, we all know that women, especially, are at increased risk of this condition called osteoporosis. So, what is osteoporosis? It means weakening of bones, and the reason why it happens is when it's because of the estrogen hormone. When the estrogen reduces in the body, your bone strength decreases, and there's also an increased risk of bone fractures when you don't strengthen, when you don't address that issue, and when you don't give enough calcium in your diet, or when you don't strengthen your bones, you might have some complications related to bones. And there's a reason why we see that a lot of menopausal women tend to have a lot of joint pains, bone pains, and also they feel weak most of the time. So it is very, very important that they take the right diet, and they need to be active. They have to avoid being sedentary, and again, increased weight definitely will increase the risk of osteoporosis. And so a healthy diet is a healthy weight, and healthy diet is a very, very important factor that all women should address, especially when they're reaching menopause and after menopause. And though we've been focusing only on calcium rich diet, I want you all to understand that for a calcium to absorb in your body, you need vitamin D. And vitamin D is a very important vitamin, and most of the time for most of the women and men, vitamin D will be very less in level, because we don't get exposed to sunlight, and sunlight is where you get most of the vitamin D from. So if you feel you are say if you have been diagnosed with less calcium in your blood levels, or if you have body aches and body pains, it is very important to check your vitamin D levels, and also take calcium in the form of diet, and also supplements if after you consult your doctor. And so these are the simple tips that would help you with your with your menopausal health. And this is a quote by Oprah Winfrey. I've discovered that the menopause is the moment that you reinvent yourself after years of focusing on the needs of everyone else. I hope everybody has a happy and a very healthy menopausal stage. Thank you.
Thank you, Dr. Shruti, for that very interesting and detailed explanation of things. So I'll quickly ask you two questions. Uh, like postpartum depression, is menopausal depression also a kind of major cause of concern?
Yes. So menopausal depression, definitely yes, because sometimes women, especially in the midlife, they already, there are sometimes they would be going through a lot of financial constraints. They might have some personal issues, and they might already have so many other things going on in their life. And that, plus when you add on these menopausal symptoms, and menopause definitely will play an important role in hormone fluctuations, and because of which they might have some mood swings. And to the extent that some women might, especially if they have some other personal life issues going on, it might aggravate their depression or even some anxiety issues. And if it is quite severe, they definitely need to meet the psychiatrist. It's something that they cannot neglect.
So is there also the element of forgetfulness in that?
Yes, yes. So definitely women in the midlife, especially in the 40s and 50s, you do find that they definitely become forgetful, and there's a very small chance that we also have this term called dementia. The forgetfulness might become more severe as they age.
And does premature or early menopause I mean, you did mention about
Yeah.
the heart diseases, the risk of getting heart diseases, but is there, I mean, does it increase the risk of menopausal women to any other kind of diseases like diabetes or, um,
Yes. So as we already spoke about it, when you attain menopause, which means the estrogen is not functioning well, right? So which means when it is a premature menopause, which means a woman is having a menopause, say less than 40 years of age, they are definitely at more increased risk of diabetes, hypertension, especially heart problems, because it is they don't have the benefit that the other women have from the estrogen for a very long time, and so these are the women we need to focus on hormone replacement therapy. So there are few treatments that we give for menopausal women, but that is it's not the treatment that we would recommend for all. Yeah. But premature menopausal women would benefit from such hormone replacement therapies, because we need to focus not only on the menopausal symptoms, but we also need to focus on their overall health, especially the cardiac health and bone health is very important in these women.
right? This is for the Hindu team. I can't see any of the doctors on screen, so I do not know whether others can see. Yeah. Okay. Dr. Divya, maybe you could answer this question about somebody's asking that I have been trying to conceive for the past 1 year, and as you described infertility in your presentation is funny. And post that, she's also on medication from her doctors, but yet she's not able to conceive. So she's asking for your
Yeah, once
opinion.
you get evaluated for fertility issues and they have corrected it, and still if you're not becoming pregnant, then the next step is you have to go for a fertility treatment. That might be some issue in conceiving naturally. So they should start with simple ovulation induction treatment. So you cannot wait that I'm not more than 1 year to get conceived naturally.
Dr. Shruti, Dr. Satya, maybe you could take this one. Dr. Shilpi Singh is asking for suggestions on some supplements for women above 37 years, which they could take regularly.
37 years and above, not necessarily should take supplements also. Your diet, which is balanced, would do a good job than taking, rather than going on fancy supplements today. Women above 40 years, as Dr. Shruti had told, to strengthen their bones with good exercise, my preference would be that rather than supplements.
Okay. And one interesting question from Vellai Selvi, which even I have heard as a kid, is skipping affects your uterus. Is it true?
You'd know it's a taboo.
It's a taboo, yeah. Dr. Divya, how to take care of health after hysterectomy?
Sorry,
Somebody's
hysterectomy.
asking, how do I take care of my health after hysterectomy? Hemlata is asking.
I think the other doctor spoke about menopause, I think. So what is that? After hysterectomy, they should take a vitamin supplementation, calcium. It depends whether they have taken off the ovaries or like that. So they might get bone demineralization and all. So they should be active, doing exercise, taking their supplements, and all those things. And if they're having any hot flashes like that, any symptoms, then we have a particular medication for that. So accordingly, it will be treated.
Somebody who's 8 months pregnant right now has a swelling in right feet due to edema and
Hmm.
also some pain at some points of time. So, what care is advised for the patient?
Sometimes this enlarged uterus will cause compression in the major vessels. So they will have swelling. So it's better that they lie down towards one side or elevate the leg. If it reduces, then they need not worry. So it is simple physiological edema. So if it's not reducing by taking rest or elevation of legs, then you should check your BP and all those things. Whether in sometimes in hypertension and all, where they get preeclampsia, pregnancy-induced hypertension, there will be swelling of legs, but it will not be unilateral. It will be both legs. So the mostly it will be compression of veins.
Anu Nair wants to know, I don't know, she says above 54 year. I am not sure whether it's a typo. Woman has undergone many cycles of assisted fertility and she's been recently diagnosed adenomyosis. So is it possible for her to conceive?
No, the IVF, I mean, if they want to undergo IVF procedure and get conceived, the cutoff age is 50. So more than 50, it's not advisable because of the health risk and all, age factor.
Um, Dr. Shruti, what are the medical tests would you advise to be taken for menopause ladies?
Okay. So the basic medical tests that we would usually assess is the basic hemoglobin, the sugars for sure, and the vitamin D, and the thyroid levels. And not and other than this medical test, it's always better to check their heart. So probably an ECG or even an echo at this age should be done. And definitely, they need to also assess their bone strength. And there are quite a few tests that we have right now to assess the bone strength. And apart from all these, they should not forget the screening, especially the cancer screening that we routinely do. Cervical cancer should be screened every 3 years until the age of 65 years, and breast screening should be done every 2 years in the form of a mammogram. So, all these are the basic tests that they need to address in a menopausal age.
Dr. Satya, Tapan Kumar Pathak is asking for his 17-year-old daughter who gets severe menstrual pain every month for 3 to 4 days.
Okay. At the age of 17, when teenage groups, they suffer from severe dysmenorrhea, some group of people. For them, we give them counseling. We can give them antispasmodics also if necessary. And in those children, at the age of 17, they may have the cramps may be so severe, they can have even fainting attacks. So accordingly, they can take as antispasmodics, or at home they can do some hot fomentation for the lower abdomen, and they can indulge in regular physical activity, which will reduce the pain.
And Pooja Garg wants to know what if endometriosis lining is very thick, what should a woman do?
Endometrium lining, it differs from every age group actually. If it is at the age of puberty and the lining is thick, they may have menorrhagia, which is increased blood flow during menses. And in that age group, it is abnormal only. That may be due to increase in the hormone estrogen. If it is in the reproductive age group, also it can cause heavy blood flow. That is also uh, it's a warning for in the post-menopausal group actually. If it is more than 4 mm, the endometrial lining more than 4 mm, it is a warning. It could be a precancerous state, or it may require any endometrial biopsy at age above 45 to 50, like that.
So there are a lot of kind of similar questions where people saying once a woman crosses 35, 40, 45, so what are the, how do we take care of ourselves? I mean, you all of you have mentioned it in your presentations, but maybe Dr. Shruti, you could just once again, summarize it and
Sure.
reiterate the message.
Yes. So women after 40 especially, sometimes they might have irregularity in their periods, and I want them to know that having irregular cycles is okay as long as their periods are probably if they're not getting periods even say in once in 2 months or once in 3 months, and if the flow is scanty, it is perfectly fine. They don't have to panic about it. The only time they need to address or meet a gynecologist regarding the periods irregularity is if the periods are coming frequently or if the periods are very heavy in nature. So probably if they have these symptoms, then they definitely need to meet the gynecologist. And coming to the diet, their diet should definitely have a calcium rich and fiber rich diet. And reason why I keep specifying fiber rich is because of the change in metabolism. They will also they will not be able to digest food as much as they used to do before. So they should have a lot of vegetables and fruits on their plate, and less of rice. And the calcium, as I already mentioned, it can be more of the calcium in the diet can be improved. But if they're not able to or if they're not aware as to what to eat, then they can definitely meet the gynecologist, and they will also benefit from taking calcium supplements with vitamin D supplements in that age group. And this is again always the calcium supplements few doctors might prescribe and few doctors might not. It's entirely the choice. But whenever a woman is taking a calcium supplement, they should make sure that they're taking a lot of water. And it's always better to do such annual checkups or annual blood and screening methods to make sure that they're doing fine. And lifestyle exercise has to be a part of their routine, weekly at least 4 to 5 times, because older women tend to become more sedentary because I don't know, somehow they feel they are a little older and they need to be more careful and they're a little scared to exercise. But it is very important that they exercise at least 4 to 5 times a week, at least for 45 minutes.
Because a lot of older women, I think, also complain about balancing, and that is what instills the fear, perhaps, to uh,
Yeah.
exercise. Right. And so
So,
supplement. Sorry. Yeah. Please go ahead.
yeah. So, for women who are a little worried about balancing, yoga will definitely help them. Because yoga, when they do yoga, it definitely also improves their flexibility, and it is also good for mental health, because a lot of women, as you also asked, they become forgetful, and the chances of psychiatric issues like depression, mood swings are quite high in menopausal age group. So yoga definitely works on both physical health and mental health. So if a woman is really scared to go to the gym or does not want to do anything strenuous, at least a basic yoga should help them.
And you did focus on vitamin D and calcium supplements. Other than that, any other supplements
Uh,
which a
so
woman could take perhaps regularly?
So I wouldn't recommend supplements only for these. And as I already mentioned, antioxidants are very important in this age group, because for having a healthy heart, you need a very good antioxidant support. For having a very healthy blood circulation in the body, you need good antioxidant support. So if they are able to eat as a part of their diet, for example, almonds, walnuts, flax seeds, they naturally are very good antioxidants. And if they are looking at supplements, then probably they can take omega supplements that are available, like fish. There are salmon fish supplements, or even um, if they are very particular about taking supplements like that, then they can take antioxidant supplements. But otherwise, a very good diet should itself be suffice for women like that. And vitamin E is also very important. In fact, they call it as the menopausal vitamin. But vitamin A, vitamin E, if they are able to consume enough vegetables and fruits, then all these should be covered in the diet itself. And another very I would say underrated food is sweet potato. Or sweet potato, though it is starchy, but it has n number of vitamins and minerals, and it is very good, especially for a menopausal women.
Dr. Satya C. Sri Lakshmi is saying her mother, no, sorry, her age is 35 years. She's a diabetic and PCOD obesity. She has burning sensation and she cannot bend her knees properly. She's not sleeping properly. She's already under a lot of medication. So, what should she do?
Her first treatment should be lifestyle modification, as she has already told, obesity, and that is another root cause for PCOS, irregular cycles, and the joint pain is also because of that. So she should go for a consistent weight reduction. It should be uniform, like every month she has to go on a weight loss program, like at least 2 kg per month. She can take at least a year or two, and I think as she reduces weight, all her hormones can resume back to normal. Her sugars will also come down. Weight loss will do wonders along with her medications. I think she should put lifestyle modification as her first mode of treatment. This would help her relieve all her stress.
Dr. Divya, would you like to take this? Somebody says we have a girl baby who has low vision because of genetic conditions, and she's 5 years old now. We are
Okay.
planning to have our second child as
Okay.
per the advice of our genetic counselor.
Hmm.
So, what would you suggest, or any habits I should follow? She's asking.
Genetic condition might be with both the parents, so they would have definitely screened for what genetic condition they have and the baby have. So the thing is, when they conceive next time, they should see the probability of getting for the next child also. Depends upon the condition, whether it is recurrent or non-recurrent genetic related thing. So accordingly, they should plan. If it is going to transfer to the next offspring also, then probably they should go for natural conception with amniocentesis or CVS in their early pregnancy to rule out whether the baby is having the same condition. Otherwise, even in IVF conception, embryos can be biopsied and the genetic causes can be identified before putting inside the mother's womb. So it depends upon the what type of genetic disease it is.
Dr. Shruti, Savita wants to know about the thyroid hormone imbalance and its effect on menopause.
Okay. So thyroid can sometimes show up during menopausal age group, and but yes, thyroid is a very important hormone that regulates metabolism in the body. So as a routine, we always check the hemoglobin, thyroid, vitamin D, and your sugars in especially in a menopausal age group. And if your thyroid if it is found to be in lesser, or if your thyroid is not in the normal values, then you need to meet the doctor and get those thyroid supplements for your deficiency.
Uh, 42-year-old Vijay Lakshmi is suffering from menstrual migraine and vomiting during her cycles for past few years. So she wants to know how to overcome it. Who would like to answer that? Menstrual migraine.
Yes. So menstrual migraine is one of the symptoms that we do encounter women with. Yeah, and one if they're only getting migraine only during the periods, and if it is becoming very severe during the periods, then they definitely need to address it, and probably they can go on some there are so many anti-migraine medications that they can go on for a longer period of time. Yeah, so that will definitely help them. In that case, they need to consult the neurologist and probably go on some medications which they can take every day, so that the symptoms during periods will also slightly come down.
So, and could one of you also talk a little about the fibroid symptoms? Jiva Jyoti is asking.
Okay,
Fibroid symptoms.
fibroids is nothing but is abnormal proliferation of the uterine muscle fiber. So there are three types. One is submucous, subserous, and intramural. That is subserous is it is lying outside the uterus. Submucous is within the endometrial cavity. Intramural is within the muscle fiber. So if the patient, someone is having a submucous fibra that is within the endometrial cavity, they might get in the intermittent spotting in between their periods. If they're trying for pregnancy, also it is an issue because they have to remove that fibroid for them to become pregnant. Or if it is there in the intramural area, they'll have severe pain associated with heavy bleeding. If it is outside the uterus, that is subserous in the outside uterine layer, it may not affect them severely, so we need not worry. So this fibroid is there in about 40% of the females. In 100 females, 20 to 40% of them are affected with fibroid. So it is not a cancerous condition, but we have to monitor the size of the fibroid. If the size is increasing in a span of 6 months, then you should worry about leiomyosarcoma. It might turn into a sarcoma. So, if the size is the same for many years together, then probably it is not going to do much. So, if the size is more like 10 centimeters, 8 centimeters, then it might go and compress the bladder or uterus adjacent structure. So, any compression issues, menstrual disturbance, infertility issues, then we have to treat the fibroid.
Like in your presentation, you mentioned Dr. Satya or I who girls start menstruating at the age, say between 12 by the age of 12 to 14. But now, we also see children are menstruating early, even at the age of 9, they start getting their periods. And then there's also an early onset of menopause. So, is it completely due to the lifestyle?
Definitely, lifestyle is one of the reasons, and predominance of junk food, sedentary lifestyle, that is the main cause of early onset of puberty. Because childhood obesity is also very common, and I think physical activity is totally come down than rather than like 30, 40 years back. So that is one of the reasons for all rise in PCOS, childhood obesity, and all. So we have to prefer organic food. The oil we use in calorie deficit for younger age groups, go for healthier diet and avoid processed and junk food and avoid these carbonated drinks and all. It may sound little strict, but this is the lifestyle to be followed for future life to prevent future diseases.
Many women also complain of a lot of leg cramps. So, is it also part of the menopausal symptoms? Maybe Dr.
Uh,
Shruti? Huh.
Yes. So they do complain of leg cramps because the most common thing when a woman gets a leg cramp is because either the calcium is less or because they are mineral deficient. Yeah, and the calcium, to improve the calcium, they definitely need to add calcium rich diet, and by having basic, by hydrating themselves, by taking coconut water, by adding minerals in the diet, like increasing the potassium levels by taking banana, coconut water, and having by giving them enough vitamins in the body, definitely all these cramps, the effect of cramps, and those symptoms can be reduced. So end of the day, all these, with age, they need to know what to eat and what not to eat, and they need to focus on diet that is good. If, for example, if they have cramps, then they should understand that they need to improve the calcium in that diet, and they need to hydrate themselves well. Yeah, and in spite of all this, if the symptoms persist, then yes, they need to consult the physician, because there can also be other medical reasons for cramps. But these are the basic lifestyle changes that they need to do before they but before, before it aggravates or before they want to get themselves checked.
So I'll wind up with one last question from Nagashri Nagendran, who says, as a public health professional, how can one effectively educate the community on infertility or dispel myths related to menstrual hygiene? What are the strategies would you doctors recommend, to kind of effectively convey the message? Maybe each of you could just give your 30-second roundup. Should we go with you,
I
Dr. Satya, first? Yeah.
Menstrual hygiene is very essential to prevent pelvic inflammatory diseases and all. It should start from even school going children. Actually, as a community worker, we should counsel all school going children about use of sanitary napkins, change of, I mean, the timing, like minimum 4 hours at least, and they should use proper hand hygiene measures, and other usage of menstrual cups and all. We can give them counseling on all that, whichever their preferences. Hand hygiene and menstrual hygiene is very important to prevent urinary tract infection or any other pelvic inflammatory diseases in the future. So hygiene starts from school.
Yeah. Um, would you like to go next, Dr. Divya?
Yeah, infertility basically people who are not planning for pregnancy. Mainly, I see in my patients, most of them they have this peer pressure in our society. That is, if they are married for like 1 year, then the parents or relatives or somebody they start questioning the couple. So this causes stress, and mostly that leads to hormonal imbalance or fertility issues. So I have seen many patients. First thing, they undergo IVF and get a baby. They spontaneously conceive the second time with a natural conception. So stress plays a major role. So as a public health professional, if you have come across someone facing fertility issues, they should focus more on the stress factor.
Dr. Shruti?
Yes. So, if you ask me, one public health mission that I would focus on would be definitely HPV vaccination, because there is still a lot of ignorance on this particular talk and topic, and it is very important to get your children vaccinated, because as we all know, HPV is the most common cause of cervical cancer, which is again one of the most common cancers in India and also all over the world. Yeah. So make sure, I think, and again, it can start from school. The teachers can be aware, the teachers can educate the kids, the teachers can educate the parents, because that is the right age to vaccinate the children. That would be between 9 to 13 years of age. And even if your child is not vaccinated during that time, you can definitely get your child vaccinated even after that. And even a married woman who is not vaccinated can still get vaccinated. That is one thing that I need to focus on. And the other important topic is importance of screening, cervical cancer screening. That because it's not a very pleasant examination to go through. A lot of women try to avoid it because they don't want to be examined, but it is very important, because cervical cancer gets a lot of patients, or a lot of women who have cervical cancer, they don't come up with symptoms until much later part of, much later, when they've advanced, or when the cancer is advanced, that's when they come up with symptoms. So it is very, very important that they screen themselves for cervical cancer every 3 years.
So thank you, Dr. Satya, Dr. Divya, and Dr. Shruti, for all your valuable inputs. And there are still lots of questions unanswered, and I may have missed a few relevant ones also, but you could kind of reply directly to them later after that, once the program ends. So there's what we all understand from what you've highlighted is there is definitely a need for targeted prevention strategies for every health condition. And it is imperative for women to go for protective screenings and lifestyle interventions if they wish to gain their health and also remain healthy. Because when we make healthy beginnings, the future is also safe. Thank you all once again for joining today's webinar on puberty to menopause, presented by Kauvery Hospitals in collaboration with the Hindu. Thank you.
Thank you, ma'am. Thanks a
Thank
lot.
you. Actually, I'm not. Why did the thing stop?